If you're living with osteoarthritis, the food you eat could be your most powerful medicine or your greatest obstacle to pain relief. Let's talk about what to eat to reduce joint pain. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge, low-risk treatments. Osteoarthritis is the most common cause of joint pain and stiffness, especially as we age. But here's something you might not realize. What you eat can play a big role in either worsening or easing your symptoms. Today, we're diving into how food affects osteoarthritis, the mechanisms behind that, how weight impacts your joints, and which foods can actually help reduce inflammation and support joint health. Let's get into it. Osteoarthritis, or OA, is what we call wear and tear arthritis. Over time, the cushioning cartilage in our joints breaks down. That leads to pain, stiffness, and swelling. But here's the real root cause: instability in the joint and low-grade chronic inflammation. As I often say, inflammation and instability are the two main reasons joints break down. Even though osteoarthritis is not traditionally considered an inflammatory arthritis, like rheumatoid arthritis, there is still low-grade chronic inflammation happening inside the joints. And that inflammation can be fed or fought by what's on your plate. Certain foods increase inflammation by triggering your immune system. These are typically processed foods, added sugars, and certain fats that send your body into an inflammatory response. On the flip side, foods rich in antioxidants, polyphenols, and omega-3 fatty acids can help calm that inflammation and support your body's healing. The goal here is simple: reduce inflammatory stress and support your tissues' ability to recover. Before we dive into specific foods, we have to talk about weight. And I say this with deep empathy and respect. Carrying extra weight is one of the biggest risk factors for developing osteoarthritis and for making it worse. Every extra pound you carry puts about 4 pounds of extra pressure on your knees. That means gaining 10 pounds adds around 40 pounds of additional stress with each step. And it's not just mechanical stress. Excess fat tissue, especially around the belly, produces inflammatory chemicals called adipokines that actively worsen joint inflammation. The amazing part: losing just 5 to 10% of your body weight can lead to noticeable reductions in joint pain and improved mobility. This is where food becomes even more powerful, not just in reducing inflammation, but also in helping with sustainable weight loss. In my approach with patients, we focus on whole, nutrient-dense foods, managing blood sugar and insulin resistance, intermittent fasting when appropriate, and incorporating consistent, low-impact movement like walking or swimming. You don't need perfection, you just need progress. Even small changes add up, and your joints will thank you long-term. Now let's talk about the best foods for osteoarthritis. First one are fatty fish. Salmon, sardines, and mackerel are rich in omega-3s, which reduce joint stiffness and inflammation. Just 2 servings a week can be helpful. Next are berries. Blueberries, strawberries, and raspberries contain antioxidants. One study has even showed that blueberry extract can improve OA, pain, and function. Next are leafy greens. Spinach, kale, and collards are high in calcium, vitamin K, and antioxidants that support bone and joint health. Up next are olive oil. This contains oleocanthal, which has anti-inflammatory properties similar to ibuprofen. It's a staple in the Mediterranean diet and one you should consider in yours as well. Next is turmeric, or curcumin, the active compound in turmeric, has been shown to reduce joint pain. Just pair with black pepper to make sure you can boost the absorption. And next are nuts and seeds. Walnuts, flax seeds, chia, and almonds can support joint health with healthy fats and micronutrients. There are some foods to avoid with osteoarthritis as well. These include added sugars that can spike inflammation, refined carbohydrates, think white breads and pastries, they increase blood sugar and joint damage as well, Fried foods, these worsen oxidative stress. Processed meats, they trigger inflammation as well. And then there's seed oils like corn and soybean oils. These are rich in omega-6 fats that throw off your body's inflammatory balance. You'll probably notice that there's a common theme here. Certain foods can increase your inflammation, and that can be a problem if you have osteoarthritis as well. A bonus, supplements to consider as well. These aren't magic, but they can help if used thoughtfully. Omega-3 from fish oil or flaxseed can be helpful. Curcumin or turmeric supplements, glucosamine and chondroitin has been shown to be helpful in up to 50% of osteoarthritis cases as well. Vitamin D, check your level, supplement that as well. Magnesium, which can aid in muscle and nerve health as well. Here's a daily eating example for osteoarthritis to consider. At breakfast, overnight oats with chia, berries, and walnuts. At lunch, salmon or chicken salad with leafy greens, olive oil, and turmeric dressing. Snack can be Greek yogurt with blueberries or almonds. And at dinner, grilled fish or lentils with quinoa, sauteed kale, and olive oil. Make sure to drink plenty of water, avoid sugary drinks, and aim for consistency, not perfection. Osteoarthritis doesn't have to mean a life of pain. When you eat the right foods and avoid the ones that trigger inflammation, you're giving your body the tools it needs to heal and move better. Pair that with a focus on healthy weight, regular physical activity, and the right medical guidance, and your joints can feel younger, stronger, and more resilient. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. You can also book a consultation to create a personalized treatment plan. Until next time, have a good day and live well.